Hello viewers, today we will discuss the topic History of Social Work in India, focusing on the initiatives undertaken by non-governmental organizations. In this particular unit, I'll be covering three domains. First, I will give an overview on the role and evolution of NGOs in India. Second, I will explore by giving case studies of major NGOs and national institutions. And after that, I will analyze the interface between government and NGOs in delivering social welfare services in the country. We will define what an NGO is first. NGO, which stands for non-governmental organizations. So basically, NGOs are voluntary organizations. They are usually meant for non-profit. Usually, these NGOs are also known as third sector organizations, and they are usually established to serve the social sector. This social sector can be in the sector of education, it can be in the sector of health, it can be in the sector of rural development. What we have seen in India is that NGOs have played a vital role in terms of the development of the nation right after the post-independence, while providing welfare services to the marginalized and the needy. Not only that, for nation building as well. Usually NGOs, the main aim of NGOs, the main work of the non-governmental organization is to provide services, fill gaps in the work which is carried out by the government, promote the rights of the marginalized and the downtrodden, and also support developmental work at the community level, be it rural area or be it in the urban area. There are different types of NGO. Usually NGOs are categorized based on the kind of services which they provide, basically which we know as the service-oriented NGO. Service-oriented NGO are those kind of NGOs which deliver direct services to the people. So the kind of services which they will provide is in terms of education. So there are NGOs who are providing free education. There are NGOs who are working at the rural area and far to reach area where government schools and institutions are not able to reach. So in those areas, NGOs are providing education, particularly primary education, to far and underdeveloped areas of the country. When we talk about service nature of NGO in terms of health sector, most NGOs who are working in providing services, they are mostly focusing on maternal and child health. Specifically, what we see in the Indian context is that they are working mostly in the rural area and also in the urban slum areas as well. The second category of NGO, which is we call it the charity-based NGOs. Charity-based NGOs are those kind of NGOs which are focusing on relief work. The relief work can be in terms of providing aids at the time of disaster. When there is an earthquake in Bhuj, Gujarat, many NGOs were responding, providing relief material to the disaster affected area. And another example of NGO can be an NGOs who are working at the time of tsunami, when we see that many NGOs are building lives and livelihood of tsunami affected area. So basically, those NGOs who are providing relief work belong to the charity based type of NGO. The third kind of NGO, third type of NGO, which we call is the empowerment NGO. These are those NGOs who are working for advocating the rights of the marginalized and the downtrodden. When I say that these NGOs are fighting for the rights, they are fighting. They are usually following the rights-based approach. The rights, the advocating for the rights, we can be for women issues, it can be for tribal issues, it can be for children rights, it can be for people who are affected by the disaster, it can be for people who are usually uh, from the slum communities. So basically those NGOs who are working for the advocating the rights of the marginalized and working for the empowerment belong to the empowerment type NGO. The fourth category, which is we call it the issue specific NGO. These kind of NGOs are focusing on a single issue. They can take up any issue which they want to focus. It can be for the sector of disability. It can be for the sector of child rights. So basically this kind of NGO works on a specific issue. There can be NGOs who are working only on environmental issues. There can be NGOs who are working only for women empowerment. There can be NGOs who are working only for rural development. So basically, such type of NGOs who are working for a specific issue, specific domain, they are known as the issue specific NGO. Key areas where NGOs are making its interventions can be divided into 5 categories: health and sanitation, education and literacy, livelihood, women and child welfare, and environment. These are some key areas where NGOs are working. We will highlight those areas where NGOs are working in these 5 domains. When it comes to health and sanitation, NGOs are providing their services on maternal and child health care, for HIV/AIDS awareness. Such NGOs who are working for HIV, usually they are known as targeted intervention NGOs. Targeted intervention NGOs are working for the commercial sex workers, they are working for transgender community, they are working for injecting drug users community. There are a group of NGOs who are working on uh, education and literacy. This group of NGOs, they provide access to education those children who are not able to engage or enroll in formal schooling because of the circumstances. Either it can be because of family issues or it can be because of the circumstances they are because of which they are not able to enroll in a formal school. Some NGOs are also working closely in the community to prevent children to drop out from formal schooling, and there are NGOs who are working for rural livelihood. They are focusing mostly their work on skill development of youths and women in the rural and the urban area. Some NGOs are working on microfinance. Some NGOs are promoting formation of self-help group. There are also NGOs who are working specific to the marginalized community, uh, such as women and children. They are providing shelter to women and children. They are providing free legal aid and support. They are providing counseling services to women and children. And also there are NGOs who are focusing on the environmental issues such as environment sustainability, the sustainable practices, environment conservation, and awareness on environmental issues. Some of the major profiles of NGOs I'll be discussing one by one. And this profile of NGOs I will discuss from based on the NGOs who are working in multiple fields such as education, health, women, and child welfare. In this, we'll be focusing also on those NGOs who are working at the national level as well as the other social development initiative. One case study which we can take up is an organization called CRY, Child Rights and You. It is an NGO which was established in 1979. Basically, this particular organization, the NGO, is working closely to ensure child rights in India. They are working through the grassroots partnership. There are many NGOs, community-based organizations who are partnering with CRY and to ensure that the rights of the children are upheld. So basically, the work which they are doing is not only restricted in one domain. They work mostly focusing on children-related education, children's health, and for protecting the rights of the children. Organizations like Child are not only restricted to service provisioning, they are also engaged in policy advocacy for child-friendly laws in our country. Second case which we can take up in India is an NGO called SEWA, Self-Employed Women's Association. This particular organization is a national level organization. They have their presence in India, in states like Gujarat, Delhi. Even though the organization was founded in Gujarat, Ahmedabad in 1972 by Ila Bhatt, what we see is that their presence is much more than the state of Gujarat. Such kind of NGOs which has more presence than one geographical area is usually known as the national level or NGO. So SEWA is an example of a national level NGO. The main focus of work of SEWA as an organization is to work with the women who are working in the informal sector. So there are many women like domestic workers, there are women who are working as street vendors, there are women who are based at home, which we know as home-based worker. So basically, SEWA is focusing on those women who are from the informal sector. What they do is that they form trade union and they work for social security, for their rights, and also at the same time they also work to promote microfinance amongst the women who are associated. They also provide health services and other legal awareness to the women in the areas where they are working. Another important organization is the All India Women's Conference. This organization was founded in 1927. This is an NGO which is working for women's issue, women's right. Earlier, when it was founded, it originally focused on women's education, but slowly it started working on other issues pertinent to women, on issues such as the Parda system, child marriage, and property right. The objective of All India Women's Conference is to promote social justice, integrity, equal rights for women, and to uphold fundamental human rights for the women. The next organization is the Indian Council of Child Welfare. We are discussing some important organizations who are working on the marginalized group. The next ICCW works for the welfare of children across India. It was established in 1952. The major program which is run by ICCW is to run CRES facilities in the communities, to run they are working mostly to advocate anti-child labor. They are working for female infanticide prevention. They are working for girl child development. What we see is that ICCW, the structure that exists is that there is a district council led by local authorities with other NGO representatives. Some of the key initiatives of the ICCW is Children's Disaster Relief Fund, and also the award, the National Bravery Awards to children or people who contributed on child welfare. A very key organizations which are working for children's issue is the SOS Children's Villages of India. It was founded in 1964 to care for the orphaned and the homeless children. The organization's main mandate is to work with the children. Their main objective is to provide homely environment, a village-like structure, a home-like facility to children who need care, support, children who are destitute. So basically, the kind of structure SOS follows is that they develop a village. In each of these village, there will be 10 to 20 family homes, and these 10 to 20 family homes, there will be 9 to 10 children staying in such kind of homes, and there will be a mother who will be taking care of such children in these particular homes which is located inside the SOS children's village. So in this home kind of setup village, which is run by SOS, children attend to local schools. They live with other children like as a real family like scenario. The other children who are staying are like siblings. They support each other till they reach the phase of adulthood. Another organization which is working mostly for the health sector is the VHAI, Voluntary Health Association of India. This organization is a national level organization. They have their presence almost in all parts, major parts of the country. It was formed in 1970, and they have a network of over 4,000 healthcare institutions. The main focus of VHSI is to work on community health, social justice, and human rights. Some of the key initiatives in the health domain for BHSI is to work on maternal child health workers training, as well as gender sensitization. The major mission of BHSI is to strengthen local health capacity and respond to emergencies effectively. Another organization which is of key social and national relevance is the National Service Scheme. Launched in 1968 during Gandhi's birth centenary as a student youth service program, this NSS services, what we see is that we see in schools and colleges of the country, the main objective is to promote personality development through community services for children and college and university going youths. The mandate in which NSS work is voluntary participation, and as well voluntary participations of undergrad students for national development, as well as to provide social service. The major activities which NSS is involved is in terms of campus improvement, tree plantation drive, adult education, health awareness, blood donation drive, as well as village development. Another important organization is the IGSS, Caritas India. IGSS work for Dalits, tribal minority communities, women and children. Caritas India was founded in 1962. They work mostly on disaster relief. The major contribution is in terms of the Gujarat earthquake, Andhra and the Orissa cyclone. Caritas India basically advocates dignity-based disaster response to the disaster-affected people. Another organization which is of key importance is the Missionary of Charity, founded by Mother Teresa in 1950 in Kolkata. The mission's objective is to serve the hungry, homeless, sick, disabled, orphan, and the unwanted. Another organization which is of national importance is the Bosco Reach Out. Bosco Reach Out was established in 1983. It is basically based in the Northeast. So it aims to empower communities through self-help group, skill development, and micro enterprises. Another organization is the Catholic Health Association of India, founded in 1943. The key responses CHAI has worked is on the Latur issues, Orissa, Gujarat earthquake, as well as the tsunami. They run health program, emergency relief, as well as the education services. The next organization, which is of national importance is Care India. Care India is a global humanitarian organization, but they became active in India since the 1950. They work mostly for the poverty uh, poverty issues, empowerment of women and girls, and also to support vulnerable families. Some of the organizations which are of national institutions which are providing services uh, to the downtrodden and the communities are the rehabilitation and special education institutions. The first one is the Rehabilitation Council of India. RCI regulates training courses in rehabilitation and special education. They maintain central register of qualified professionals. They are institutions which are recognized by RCI. In India, these RCI recognized institutions, they usually provide standardized long and short term courses for those professionals who are working in rehabilitation and special educations. The second institution, which is of national importance, is the Institute for Physically Handicapped. This particular institution offers training and outpatient rehabilitation for orthopedically disabled. They also provide special school for children who are severely orthopedic handicapped. The third one is the National Institute for Mentally Handicapped. This particular organization institution is based in Secunderabad, focuses on mentally disabled disability services and research. They provide consultancy services and also documentation work. The next one is the Ali Yuvarjung National Institute for Hearing Handicap, located in Mumbai, with regional centers in Calcutta, Delhi, and Hyderabad. Runs adult deaf training centers also in Hyderabad. They provide training and rehab services for the hearing impaired. The next institution, which is of national importance, is the National Institute for Orthopedically Handicapped. Based in Calcutta, they offer rehabilitation, research, and training for the orthopedically handicapped. The next is the National Institute for Visually Impaired. Based in Dehradun, they work for the visually handicapped. Community-based rehabilitation and model schools are also run by this institution. Then we have the Nirta Katak, this particular institute, they do medical and rehab education and rural outreach camps. Then we have the National Institute for Empowerment of Persons with Multiple Disabilities, located in Tamil Nadu. These particular institutions promote education, training, employment, and empowerment of the PWDs. Thank you very much.